Hi, do you have hip pain that's on the side of your hip? Maybe you might feel a little bit of tenderness when you press directly on the side. You might also feel like it's squishier than the other side. If that's you, you probably are dealing with something called hip bursitis. Maybe you went to the doctor and the doctor also diagnosed you with hip bursitis. If you're dealing with this, give these exercises a try. We think these will help you. We're going to start with a dynamic hip flexor stretch. So we're going to start in the half kneeling position, and the hip we're trying to stretch, that leg is in the back. Okay. So for me, I'm doing the right side. So we're going to start hand here supported a little bit. For ballads, we're going to engage this left glute before we start. So we're going to squeeze the butt cheek of the back leg. And then what we're going to do, we're going to shift our weight forward here. And we're going to feel a stretch through the front here. We're going to count to 5. Then we're going to rock back closed. And then we're going to rock forward again. We're going to count to 5. Keeping the butt engaged. Then we're going to rock back. And each time we're trying to get a little bit further and a little bit further. We're going to do this for 12 to 15 reps on each side. Next, we're going to do a release of some of the tissue surrounding the hip that's causing some of the tension relationship that's happening, causing that bursa to get inflamed. So the main points here is finding where that bursa is. If you kind of feel around, you'll feel it soft and squishy a little bit, or you're going to feel a really tender spot. And if you press deeper, you're going to feel a bone there. Because there's not a lot of muscle tissue that covers that, you'll be able to feel it. We're going to avoid hitting that spot directly, and we're going to work around it like an upside down horseshoe here, okay? So we're going to I have a lacrosse ball here. You can use a tennis ball or any other small ball. We're going to start with this knee slightly bent, and we're going to put that right in front of where that bony landmark is, and we're just going to put a little bit of pressure on it by rolling slightly forward. It's going to feel a little uncomfortable there, but it shouldn't be too painful. So you're going to manage your weight by how much you shift over it. So if it's too painful, don't put as much weight on it and back off a little bit. So we're going to work this front spot here for about 30 seconds to a minute. And then we're going to move this ball a little bit more lateral. Instead of here, we're going to move it a little back. And we're going to be above that hard bony landmark now. And we're doing the same thing. We're controlling our weight and rocking back and forth on it, or we can just stay there. Again, we're going to work this for 30 seconds to a minute. And then we're going to work on the back side of it. So now we're here on the back side here, and we're gonna shift. In this one, if I roll forward, it's gonna take pressure off. If I roll backwards, it's gonna put more pressure on it. So it's gonna be the opposite of the first one. And here we're just gonna work 30 seconds to a minute also. So take some time and work on this for, a minute and a half to 3 minutes. The next exercise we're going to do is a modified side plank. We're just trying to get a little more lateral and posterior strength and stability of that hip. So we're going to start on our side here on our knees. We're starting with our hips closed. What we're going to do is we're going to brace our belly. We're going to squeeze our butt cheeks, and then we're going to lift up here, and then we're going to squeeze our butt and drive our hips forward so our hips are open now instead of slightly closed here. So we're up, we're opening, we're holding for 10 seconds. Then we're going to slowly come back down and close our hips again. And then we're going to go up again. We're going to hold for 10 seconds. Make sure we're squeezing our butt cheeks and we're squeezing our core. We're holding for 10, and we're coming back down. We're going to repeat this for 10 on each side. This last exercise is going to help us with our weight shift when we're sort of walking and standing and doing activities here. So we're gonna get a step. This step is 6 inches. That's just the standard step for a stair. So if you have stairs at home or steps leading up to your house, this will be the perfect step to do it on. If not, get a couple books or, a wooden step or something that you can use just to practice this. I recommend doing this at the counter or with a railing so that you don't fall. I'm just going to use a stick just so I can show this to you and you can see a little bit better. So we're going to stand on the affected leg. So again, we're doing the right leg, the right hip here, and we're going to keep this leg straight and try to drop this foot down. See how I'm reaching and this knee stays relatively straight. I'm going to feel that load in the hip here, and then I'm going to try and pull this hip up, and I'm going to hold for a 1-2 count, and then I'm going to slowly lower it back down, and then I'm going to feel that load here again, and I'm going to hold for a 1-2 count, and then I'm going back up, and I'm trying to hold for a 1-2 count. You should feel this in the lateral hip here. You might also feel it a little bit in your abs here. We're gonna do this nice and slow for 10 to 15 repetitions on each side. Thanks for watching this video. These exercises are just a starting point for getting rid of the hip bursitis. So we recommend actually having a consultation with a physical therapist so they can guide you through the whole process. With hip bursitis, a lot of times it gets a little bit better and then people will plateau out and start getting discouraged. But the exercises actually need to evolve and change as our symptoms improve to get us back to full normal functioning without the pain again. So please make a call, get a consult done so they can guide you through this process. If you like this video, please check out our channel, like, subscribe, and share. Thanks.